Okay, so visual impairment is also classified as partial, severe, or complete. Severe visual impairment may also be called legal blindness, and it just means that person with or without correction cannot see enough to function safely or to perform tasks that require vision safely. Refractive disorders are the most common type of visual impairment. Myopia or nearsightedness is really common. Hyperopia, farsightedness, is less common in younger people. Both are inherited, but presbyopia, when someone develops some farsightedness as they age, is much more common. Myopia is the most common. Strabismus is when the eyes don't look in exactly the same direction. It can lead to visual impairment because of amblyopia, when eye wanders off. The cause is not known. In amblyopia, the nerve pathways to one eye are not stimulated and the other eye is favored. There's an eventual decrease or loss of vision in the affected eye. Trauma can cause damage or infection. Trauma or infection can cause damage and loss of eyesight as well. Diagnosis in infancy, we look at whether the infant is responding to visual stimuli. And as children get older, they have visual acuity screenings. And those screenings for kids who are pre-reading may use pictures, or they may use E's that all point different directions. So there are some screenings for people who can't yet identify letters. Management of visual impairment, we want to promote attachment, especially babies who are, or parents who are completely blind. Reciprocity is very important in bonding, and a lot of that for most of us is visual. We're looking at that child. Are they responding to us? So we can help parents look for other cues that the child is responding, because the baby that's blind may not meet their eyes, and we may need to help blind parents find ways to identify to communicate with the child, and also to determine the child's communication with them, to perceive that communication. We want to promote development for children who have severe impairment or are completely blind. We want to use non-visual cues. Give them some ways to find their way around, ways to find their things. Clothing can be organized by color and style. We want to teach navigational skills. In the home, we don't move people's things around if they can't see. They may also learn to use a cane and tap for navigation. They may use a human guide or a guide dog. We want to help with play and socialization. So kids who are completely blind from birth often have to be taught to play because they can't see others to imitate. So we can teach them activities through touch and sound. In education, there's a trend toward inclusion, which is a positive thing, but we want to teach these kids Braille. We want to have teachers and classmates learn how to provide non-visual cues and communication to them. There are voice synthesizing devices to allow them to take written media and turn them into a communication that works for them. And there are recorded books. If a child is partially sighted, then we want to try to help them get the appropriate correction and visual aids as needed. During hospitalization, someone who is blind or has severe visual impairment needs to be oriented to their surroundings. We need to make sure the environment is safe. The call light needs to be in reach and easily located. Sometimes if it's like on the side of the bed or it's on a remote with a lot of other things, one thing that I've seen done is tape a cotton ball over that so they can find it by feel. Or try to provide a call light button that's just the call light with nothing else. We want to make sure that we don't move things, we don't hide their cane. If they can have a family member present, that's helpful. A rope or a string may help them navigate back and forth to the bathroom. You always want to speak to a blind person when you're approaching them. Don't sneak up on people, and explain any unfamiliar sounds. You want to tell them what you're going to do before you do it. And that's very hard to remember, especially when we're in a hurry. And we want to provide recreational activities that use other senses. If the patient has had a procedure to restore their sight, we need to make sure that we're giving them some time to adjust, and that can be a major adjustment in their lives. For preventing blindness, there's prenatal screening and prevention of infection, because infection is a common cause of neonatal blindness, prevention of prematurity, rubella immunizations, safety teaching. So there's a lot of things that we can do to try to prevent blindness. So what happens if a child is hearing and visually impaired? So frequently, if we have an impairment in one of those major senses, because those are the senses that we use the most to bring information in. If we have an impairment in one, we use the other to accommodate for that. We get more information from vision if we can't hear, and vice versa. So loss of both has a severe impact on development. Those kids can achieve milestones, but they're typically delayed. Communication requires specialized training. One of the ways that we can communicate with someone who is both blind and deaf is by finger spelling words. They can learn the sign language alphabet, and we can finger spell. Okay, in the next section, we're going to talk about eye-related emergencies.